Good morning to all. My name is Anusha. I am working from Emmanuel as a College of Nursing. Today we are discussing about lung anatomy. Introduction. Lungs are a pair of respiratory organs situated in the thoracic cavity. Each lungs innervates the corresponding pleural cavity. In the young, lung are brown or gray in color. Gradually, they become mottled black because of the deposition of inhaled carbon particles. The right lung weight 700 gram. It is about 50 to 100 higher than the left lung. Features. Each lung is conical in shape. It has apex at the upper end, base resting on the diaphragm. Three borders, anterior, posterior and inferior. Two surfaces, costal and medial. The apex lies above the level of the first rib. It reached 2.5 centimeter above the medial of one-third of clavicle, just medial to supraclavicle fossa. The base rests on the diaphragm, which separates the right lung from the right lobe of the liver and the left lung from the left lobe of the liver, fundus of stomach and the spleen. The anterior border of the left lung shows a wide cardiac notch below the level of the fourth costal cartilage. The heart is pericardium or uncurved by the lungs in the region of the notch. Root of the lungs. The root of the lung is a short border pedicle which connected in the medial surface of the lungs to the mediasternum. It is formed by the structures which either enter or come out the lung at the hilum. The root of lungs lies opposite the bodies of 5th, 6th and 7th thoracic vertebra. Contents of root of the lungs. Principal branches on the left side and apparatus and hypoarticular branches on the right side. One pulmonary artery, two pulmonary vein, superior and inferior. Bronchial artery, one on the right side and two on the left side. Bronchial vein, anterior and posterior pulmonary pulsuses of nerves. Lymphatic of lung, bronchopulmonary lymph nodes, areolar tissues. Bronchial tree, bronchopulmonary segment. These are well defined sectors of the lung, each one of which is aerated by a tertiary of segmental bronchioles. Each segment is pyramidal in shape with its apex directed towards on the root of the lungs. These bronchopulmonary segments are independent respiratory units. Left lung bronchopulmonal segments. Upper lobe, apical, anterior, posterior, supralinguinar, inferior, superior linguinar, inferior lingular. Lower lobe, superior, medial basal, anterior basal, lateral basal, posterior basal. Right lung bronchopulmonary segments. Upper lobe, apical, anterior, posterior. Medial lobe, medial, lateral. Lower lobe, superior, medial basal, anterior basal, lateral basal, posterior basal. The branches of the pulmonary artery accompany the bronchi. The arteries lies dorsolateral to the bronchus. Thus, each segment has its own separated artery. The pulmonary veins do not accompany the bronchi or the pulmonary artery. They run in intersegmental plans. Thus, each segment has more than the one vein and each vein drains more than one segment. Usually, the infection of segmented remains restricted to it although so infection like Tuberculosis may separate from one segment to another. However, the segments are no barriers to the spread of bronchogenic carcinoma. Arterial supply. On the right side there is one bronchial artery which arises from either the third posterior intercostal artery or from the upper left bronchial artery. On of the left side there are two bronchial arteries, both of which arise from the descending thoracic aorta. There are precapillary anastomosis between bronchial and pulmonary arteries. These connections enlarged when any one of them obstructed in disease. Venous drainage. Usually there are two bronchial veins on each side. The right bronchial vein drains into the azygous vein. The left bronchial vein drains either into the left superior intercostal vein or into the hemiazygous vein. The greater part of the venous blood from the lung drained by the pulmonary vein. Nerve supply. Parasympathetic nerves are derived from the vagus. These fibers are motor to the bronchial muscles and of stimulation caused bronchospasm. Sacromotor to the mucus gland of the bronchial tree. The sensory fibers are responsible for the stretch reflex of the lungs and for the cough reflex. The sympathetic nerves are derived from the second to fifth spinal segments. These are inhibitory to the smooth muscles and glands of bronchial tree. This is how symptomatic drugs like adrenaline caused bronchodilation and relieve symptoms of bronchial asthma. Thank you.